Good evening, ladies and gentlemen. Thank you all for coming and joining us here tonight. My name is Angela Chang, and I'm currently the Tech Comm team lead for this semester. Over the course of the last semester, the technology commercialization team has done extensive research to learn about a brand new chemical compound named Pericosine. They have also researched to find the best way to bring this chemical compound to market. They've conducted intensive surveys and interviews with different pharmacists, doctors, and potential consumers, as well as mastered the art of contacting and discovering the contact information for people at multinational corporations through the wonderful website LinkedIn. I am so proud of all of the hard work that this team has accomplished. They've not only been motivated, but persevered through many challenges that they faced through LinkedIn. And so they have done so much work, and I'm not only so proud of this team, but I am really grateful that I've been able to work with these four individuals who are extremely intelligent, extremely humorous, and just extremely motivated. I'd also like to thank the individuals that have helped us along the way, which include our mentor, Dr. Robert Chehevitz, our mentors, Andrew Pollock, and as well as Ron Davidson and Jim Bratton, and finally our lead scientist, Dr. Lin Du. So without further ado, I'd like to introduce to you our TechComm team for this semester, Jamie, Landon, Josh, and Hayden, as they explain to you the amazing potential of the chemical compound Pericosine. Thanks.
How many of you know someone or has yourself been affected by poison ivy? There's a lot of you here tonight, and I'm glad, because I want you to know that you're not alone. In fact, each and every year, 50 million Americans are affected by poison ivy. 50 million people know that itching, burning rash that in 20% of cases can actually cover 4/5 of the entire body. But what if there was a product that could neutralize urushiol, which is the active toxin in poison ivy? What if there was a product that, if applied early enough, could actually stop a rash from forming? Well, we're here tonight to tell you that the time has finally arrived. Hi, my name is Jamie Franzese. I'm an International Studies junior from Edmond, Oklahoma.
Hi, I'm Landon Wright, and I'm a Petroleum Engineering junior from Edmond, Oklahoma.
Hi, I'm Josh Imbriani. I'm a Computer Science senior from Columbus, Ohio.
Hi, I'm Hayden Paget. I'm a Petroleum Engineering junior from Wichita, Kansas. With our team lead, Angela Chang, inventor Dr. Robert Chehevitz, lead scientist Dr. Lin Du, and mentors Jim Bratton, Andrew Pollock, and Ron Davidson, we are Team Ivy.
Since 2014, Dr. Robert Chehevitz has been working with lead scientist Lin Du and the Natural Products Discovery Group to develop Pericosine. Pericosine was developed as a result of a crowdsourcing initiative which sought to bring soil samples from around the country in to discover new and exciting natural products. Pericosine has resulted as the most exciting innovation of the 25,000 soil samples collected. Already, scientists have ideated numerous viable scientific applications for Pericosine, including poison ivy neutralization as well as skunk odor neutralization. As a team, in order to understand the market more fully, as well as the product, we've done interviews with dozens of scientists and pharmacists, as well as licensing representatives from different multinational organizations, and garnered survey results from over 200 participants. We're so excited to share with you tonight our research and our understanding of Pericosine. So first, let's start with the applications of Pericosine. In the first place, we've ideated over 30 different applications for Pericosine. Although a few have proven to be scientifically not viable, some have shown significant promise. While certain require further testing in order to validate their scientific viability, poison ivy and skunk odor have already been validated as applications for Pericosine. For the purpose of this presentation, we've decided to move forward with an understanding of the poison ivy market for three key reasons. First, we've identified a $1 billion market that is largely underdeveloped. Second, we've identified a problem that is really growing in size and hasn't been adequately addressed. Third and finally is the application of Pericosine and its scientific viability. We believe that Pericosine has the ability to address these 3 points. So let's talk a little bit more about the problem of poison ivy. Poison ivy, as it is right now, affects 1 in 6 Americans. However, according to data from the CDC, this number is growing as a result of increase in carbon dioxide in the atmosphere. This means by the year 2050, we expect that 2 in 6 Americans, or 1 in 3, will be affected by poison ivy. However, because of pericosine's unique chemical structure and properties, we expect that this number should, while this number will continue to increase, pericosine should be able to increase the quality of life for those individuals that will continue to be affected. So how does pericosine work? Well, pericosine, being a byproduct of a fungus, is able to chemically bind and alter the chemical structure of the toxin. So first, pericosine is applied to the toxin and then binds to the toxin, creating a non-toxic product. This means that the toxin is no longer harmful to the individual who utilizes the product and can then be washed away, and it will not continue to infect the individual. Now that you know a little bit more about pericosine, its exciting applications, and a little bit about how it works, here's Landon, who's going to tell you a little bit more about the market and its viability.
Thank you, Jamie. In looking more into the marketplace for poison ivy treatment methods, we found that consumers are currently not taking advantage of existing alleviation options for that poison ivy poisoning, and therefore there is plenty of space available for pericosine to transition into the marketplace. Currently, only 10% of consumers are actually using a poison ivy product to treat their poison ivy rash. These products include Technu, Iverest, and Zanfil. An additional 20% of consumers are going out and using products like antihistamine and Benadryl, which are not able to actually have a great impact on the rash, and therefore those consumers are not deriving a great benefit from using those products. An additional overwhelming 70% of individuals are actually not using any product at all to impact their poison ivy rash. From a survey of 200 different respondents, we found that these individuals are likely just letting the rash run its course since they've been discouraged by previous product usage, or they've been able to consult with their doctor and found that other products on the marketplace are not able to actually impact their rash. In looking more into the marketplace and looking at the competition, we found that pericosine is an effective and low-cost alternative to existing treatment methods with a high marketing potential. Firstly, in looking more into Zanfil, we found that Zanfil acts more as a soap, being able to wash away the urushiol poison from the skin, but not actually able to impact the rash. On the other hand, both Technu and Iverest were not doctor recommended, which was something that we found in conversations with 20 different doctors and pharmacists. These products act more as a coolant for consumers and aren't able to actually treat the rash, more making the consumers feel like the product's working while are not actually deriving any benefit from that product. And looking more into our competition in the marketplace, we found that Zanfil is most likely to be a pericosine-based product's main competition in transitioning into the market. And looking at the pricing structure, we found that our team's research indicates that pericosine would cost about $25 an ounce, while consumers are already paying $44 per ounce for something like Zanfil. Pericosine is able to work more effectively than the existing products on the market because it's able to actually neutralize the poison ivy molecule and therefore able to prevent it from causing that rash that I'm sure so many of you have experienced. And looking at a separate avenue from this effectiveness and cost, we found that pericosine is likely to also have a great ability to be able to market itself in the marketplace. Currently, Technu, Iverest, and Zanfil have no real marketing scheme and therefore are mainly relying on word of mouth and on doctor testimonials to be able to spread their product to different consumers. However, given that 2 of the products are not doctor recommended and only one of the products is partially effective, pericosine, if partnering with a great licensing firm or with a different business structure, will be able to effectively transition into the marketplace with an effective marketing plan that will be able to get out the word about the great benefits that consumers can derive from using this product. Now that I spoke to you a little bit more about our understanding of the marketplace and of our competition, I'm going to pass it off to Josh, who's going to be speaking a little bit more about our understanding of a business plan moving forward.
Thank you, Landon. So now that you've heard about why pericosine is so amazing and why a pericosine-based product differentiates itself in this market, let's talk about how to get pericosine to market. So in order to answer this question, we spoke with dozens of pharmacies, both independent pharmacies and big box pharmacies, as well as managed to get 2 interviews with licensing executives at major corporations. And we found that licensing to those major corporations is the best way to bring pericosine to market. So what does that look like? Well, it starts with OTD. OTD, the Office of Technology Development here at OU, currently holds a provisional utility patent over Pericosine for the uses of poison ivy and skunk. They would license this technology in exchange for a one-time fee as well as a 5% royalty on every product sold to a manufacturer. The manufacturer would complete any necessary testing to bring the product to market, manufacture the product, and distribute it via their existing distribution chains to retailers. The retailers would then put the product on their shelves and sell it to consumers, sending about 50% of the profit back to the manufacturer, and then the 5% royalty back to OU, thus creating profit for the university. So now that we know about what marketing or what licensing would look like, let's talk about who to license to. So we determined that Bayer or Johnson & Johnson are the best licensees going forward. Why is this? A few reasons. Well, first, in speaking with them, we learned that they are willing to work a product through to market. So Pericosine is a very early stage product. It still needs a lot of work before it's ready to be on store shelves. And both of these corporations have indicated that they are willing to work with a product and bring it over these lasting hurdles to bring it to market, thus making it a great fit for Pericosine. Second, they both have existing products that would fit extremely well with Pericosine. They have dermatological products, which means that Pericosine would be a great fit. Third, they both have the reach necessary to expand the Pericosine poison ivy market. So this primarily manifests itself in two ways. One, there are about 42,000 independent pharmacies and big box pharmacies in the United States. Both of these manufacturers have massive distribution chains that would be able to get the product in up to some, if not all, of those stores should they feel like the product has enough value. And second, they both have multi-billion-dollar marketing budgets that they could use to expand that 10% of the market that currently buy poison ivy products into the 20% that use antihistamines and maybe even into the 70% that currently do not do anything for poison ivy. So, and finally, the most exciting reason is that in speaking with Johnson & Johnson, they indicated that they are looking to, quote, play in the poison ivy space. They are actually actively seeking out a poison ivy solution, which means that Pericosine has a great chance of being brought to market by them. So now that we've learned about who Pericosine should be licensed to and why licensing is the best choice, I'm going to turn it over to Hayden, who's going to talk about how much money it can generate for the university.
Thanks, Josh. OTD has the potential to generate nearly $500,000 in royalties a year by licensing Pericosine. This is based upon a licensing deal with our recommended licensee, Johnson & Johnson, in which case 5% royalties are negotiated back for OTD. This financial model is dependent upon the product being sold at $25 per unit, in which case this is marked up 10 times from the production costs we had estimated by a chemical production company here in Oklahoma. This 10 times markup is important, as when talking with licensee representatives, a key factor they stress they look for in their licensing deals is the profit margin that a product can be promised. This $25 retail price also corresponds to our survey results, in which 85% of respondents said they would be willing to spend $20 or more on Pericosine. Through further research, statistics published in Forbes magazine show that licensed products tend to generate the most royalties back for their inventor when sold in the $20 to $30 range. For these reasons, we recommend that this product is sold at $25 unit price. Now, upon a licensing deal with Johnson & Johnson, we estimate that Pericosine could be supplied in over 21,000 retail outlets nationwide. This encompasses all the large chain supermarkets and drugstores across America. Now, based on our current market analysis of other product sales in the market, we estimate that this product could sell 16 units per store in its first year on the market. This has the potential to grow into something much larger in the future, especially taking into account the highly underdeveloped poison ivy market that it is entering into. Upon a licensing deal with Johnson & Johnson, OTD can then capitalize on its underdeveloped market and develop substantial profit through royalties from Pericosine. Now, before these royalties can begin being generated, there are a few steps that need to be taken to get to this state. For this reason, we recommend that further testing and patenting is necessary for Pericosine to be commercialized. The first step in this process is determining the final formulation of Pericosine. Upon this, OTD can then file for the composition of matter patent. OTD currently holds the provisional patent for the uses of Pericosine on skunk odor and poison ivy. However, when talking with licensee representatives, they stress that they much prefer the composition of matter patent in their licensing deals. They also informed us that proving the product's safety would give a strong favorability for the product in obtaining a licensing deal in the future. For this reason, we recommend that Dr. Chievich conduct the 6 tests necessary to market a product as a cosmetic. These tests have already been underway, and currently the product shows no sign of being harmful for the consumer. Now, while these steps are being done, we also recommend that Dr. Chievich continue researching other applications of Pericosine to fully understand the total reach it holds in the marketplace. Now, since Johnson & Johnson shows interest in licensing a poison ivy product, we recommend that the talks between them and OTD begin immediately. However, from information we have already obtained, we recommend that the actual negotiations for licensing take place after the final composition of matter patent has been obtained, which oftentimes takes about 3 to 5 years, and then the product safety has been proven. This will give Pericosine the greatest opportunity in obtaining a licensing deal. Now, upon this, the final stage in the process is simply for OTD to begin receiving royalties for this product. Now, if there are 3 things we want to leave you with in this presentation, is that Pericosine has a great opportunity to enter into the current poison ivy market. This market is valued at $110 million and has the potential to grow into something much larger in the future. Secondly, upon a licensing deal with Johnson & Johnson, it's estimated that Pericosine could generate substantial profit through royalties of nearly $500,000 a year by capitalizing on this underdeveloped market. And thirdly, Pericosine's reach is much greater than simply the poison ivy market. We've touched on a few of its other applications here in this presentation tonight. However, due to the unique chemical structure of Pericosine, it is estimated that there are many other applications out there yet to have even been discovered. For these reasons, Dr. Chievich and OTD are very excited for the future that Pericosine holds in the marketplace. Thank you for your time. We'll now open up the floor to questions. Yes, sir.
Many of you had the experience with poison ivy that gave you some inspiration in this process.
So the question was, have any of us been impacted by poison ivy before? Right when I first came back sophomore year, I had a really bad bout of poison ivy, and so I was really excited to hear about this project. I mean, how were we going to be able to improve the current options for consumers in the market? Because everything I tried didn't really work, and I ended up having a poison ivy rash for about 6 months. So it was horrible, and it's like a systematic infection, and I had to go to the doctor like 6 times. So I was very drawn to this project. Thank you.
Yes, ma'am.
Is it reasonable to assume that in the first year, it didn't have 17% market share?
Yes, so the question was, is it reasonable to assume that the first year on this product on the market, is it reasonable to have 17% market share? So our financial model is based upon, in that first year, the minimum sales that we estimated would be required to keep a product on the shelves. This is obtained from the interviews we've had with retailers and the minimum amount of products that are being sold in their store for those products. So we based our assumptions off the minimum amount that Pericosine would need to sell in its first year to remain on store shelves without being pulled off. Yes, sir.
You indicated that your first $25 was per ounce of Pericosine, but the cost also of final product was $25. Do you account for packaging and entire?
So the question was, the estimated price for Pericosine was $25 per ounce, and then our total price was also $25. So we account for the packaging as well? Yes, so the question, to answer that question, we took into account the packaging and everything that goes into that final product, and that was the estimation that came back with $2.50 per ounce for product manufacturing, and then marking that up 10 times to the retail price of $25. Thank you. Yes, sir.
What area of skin exposure to 1 ounce do you expect to cure?
So the question was, how much skin area can 1 ounce of Pericosine-based product cover? So we estimate that if it just depends on the final formulation and the way that the product takes form, which has yet to be determined. However, if it is in sort of a cream, we have discussed with our competitors that 1 ounce should equal about 15 doses.
Yes, sir.
So if I heard right, it's going to take 3 to 5 years to test the product safety. And if I did hear that, then if you look into other alternatives to monetize the product before 3 to 5 years.
Yes, so the question was, the 3 to 5 years for the product safety, is there any way to monetize the product before those 3 to 5 years come up? Technically, I believe this wasn't conveyed directly clear, but the 3 to 5 years is the patenting process and how long it takes to receive the final composition of matter patent after filing it. And the product safety could be done before then. However, from the talks we've had with current licensees, they say that they would be willing to take on the product pretty much in any stage, whether it be very early and move it through the process. They've even taken products much earlier than where Pericosine is at the moment, so getting it off into their hands could also be another alternative. Thanks. Yes, sir.
So we had a question come in off of our Facebook live stream. This is from I-CCEW alumni Daniel Meshner. He says, I would love some Pericosine the next time I go hiking, but what are the practices of using it? Should it take the form of a topical spray or solution? And how long would it take to effectively combat the rash?
So the question was, what will the final product of a Pericosine-based product look like, and how long will it take to be activated? So this ends up largely falling on what the licensee decides on doing once they obtain the license to a Pericosine. So yeah, we don't know yet.
We have time for one more question. Oh, sorry, right up there. Miss?
Great presentation. Firstly, I have two questions. The first one is, how did you decide which consumers you were going to call and interview? Like, what was the criteria for that? The second question is the goal to sell to pharmacists or directly to stores like Walmart? Like, what is the plan in mind?
So I'll take the first question. The first question was, in doing our consumer surveys, what consumers did we end up reaching out to? We had 2 different surveys over the course of the semester. The first survey was mainly directed at OU students who have had poison ivy before, and the second survey was mainly directed through my mom's friends, because that was a great way for me to be able to get an older generation's perspective on who's actually purchasing the product.
And for the second question, would we be selling this product to pharmacies or to the big box stores such as Walmart? Technically, when talking with the licensee Johnson & Johnson, they stress that they don't want to get into necessarily the RX side, so they'd much rather be in the big box stores, whereas they would be selling these products to all individuals. And yeah.